exercise, quite often you can improve your health and improve your metabolic health naturally and heal from chronic conditions rather than continue to be prescribing more and more medications, which leaves you low carb, intermittent fasting, and strength training.
Mm.
So if you tell your patients these are the three ways to lower your insulin resistance, then gives them some framework. It's another whole new world that we've never been taught how to breathe better.
Hello, everyone, and welcome to another episode of Passive Income Doctor. Today, we have a special guest, Dr. Avi Charlton, GP and founder of Melbourne Low Carb Clinic. Graduated from Melbourne University 2000, has been GP since 2003. And, website talks about, own weight loss journey, and also now is a speaker and also does some breathwork, which we'll get into as well. Welcome to the show.
Thank you, Daniel. Thank you for having me.
Um, so do you want to tell the audience a little bit more about what you do, day to day, or if there's such thing as an average day?
Yeah, sure. I am a GP for about over 20 years. As you said, I finished year 2000, so I've been a doctor for almost 25 years, amazingly. And we're just organising 25-year gathering in the year 2000 cohort, Melbourne Uni. I'm a GP, and my usual day is I still do normal general practice. I still see whatever comes in, coughs and colds, and anything that comes in. But about 2.5 years ago, I decided to brand myself and start up a new GP with special interest clinic called Melbourne Low Carb Clinic. Because about 2.5 years ago, before that, developed an interest on metabolic health, weight management, therapeutic carbohydrate restriction, and that has been a really rewarding journey. I had lots of people coming from all over Victoria and even Australia coming to see me because they wanted to see a GP that is understanding of the low carb people, ketogenic diets, and even carnivore diets. So I've looked into it and dug into nutrition and did quite a few courses on nutrition, lifestyle, and I am proud to say I've learned heaps and heaps, a lot more than what medical school taught me. And I've incorporated into the usual general practice. So I would prescribe people with healthy low carbohydrate diets, and they can improve their metabolic health. Sometimes with diabetics, they can really reverse their diabetes or even get off their medications, including insulin or oral hypoglycemics. And they lose a lot of weight. They get much more energy, reduce symptoms, and they feel much better. So this is terribly rewarding. Not everybody can do it, but those that can do it has been a fantastic journey for them and me. And that's why I branded myself as Melbourne Low Carb Clinic about 2.5 years ago. And since then, I have advertised myself and promoted myself. Ultimately, I really want to do more and more of the low carb clinic work, metabolic health work. And I've opened up more of promoting healthy lifestyle in terms of not just nutrition, but also stress management, breath work, and even helping people with exercise and strength training, talking about sleep and all aspects of lifestyle. So hopefully I can reduce the normal general practice coughs and colds, mundane general practice work, and do more and more of the low carb clinic work. And ultimately, I want to do more speaking jobs. And I've had my first paid speaking gig a couple of weeks ago. I was invited to a retreat to do a breathwork workshop as well as a nutrition talk. So that's my hope of getting into more of a GP with special interests GP work. and speaker work rather than the mundane coughs and colds work, which I'm still doing. So that's my story in a nutshell.
Yeah, and well done on the, paid speaking gig, which we'll talk more about as well. So I guess, a couple of years ago when you decided to kind of become GP special interests in, diet, weight
Mm.
management, was there anything in particular that sparked that? Was it, or maybe it was a few things, was it kind of wanting to move away from traditional general practice, or was it something else that made you kind of want to pursue this area?
Yeah, I think it's a combination of things because I've listed my name in the website called Low Carb Down Under. And you can check out that website and YouTube channel with lots and lots of education videos to learn about why low carb works. So I've listed my name in a directory, and people have been coming all over Victoria and even Australia to come and see me. And working in a bulk billing clinic, people aren't actually motivated to change because they haven't invested in money in the consultation. So it's a combination of wanting to provide a longer consultation and wanting people to invest more in their health and also branding myself. And so all those is that's why I decided that I'm going to start Melbourne Low Carb Clinic. And it was just a all of a sudden I woke up one morning 2.5 years ago. I told my husband that I'm going to start a low carb clinic. And it was a very gradual process. I didn't really have much capital. I told my boss, who I've worked for almost 20 years, I told him that I want him to help me and I wanted a separate room in the usual clinic that I work in. So he helped me set up a special room, put out some signs in the usual clinic, and I had the same arrangement with him with the billing process. So it was a 70,
Mm,
30% division. So there wasn't any much change, but he helped me put out some furnitures and
mm,
signs of Melbourne Low Carb Clinic. And I set up website. I started to learn about marketing, started email list to gather how to learn about email marketing. And I put myself out onto social media a bit more and learn how to do more of social media marketing. So all that combination started my journey on how I branded myself as Melbourne Low Carb Clinic.
mm. And kind of, I guess, kind of like a contractor relationship with the clinic owner. Did you think of, maybe, starting out all your own on your own, or did you think kind of this was more of a gentler transition? Do they do the back end admin stuff, or do you have kind of control over the admin, how much to charge, etc.?
Yeah, yeah. Before I started the low carb clinic, I did think of going out on my own and hiring some rooms just like specialist does. And but then the problem is if I don't have any bookings, then what am I going to do?
Mm,
I'm going to sit around and not do anything and no money coming in. So unfortunately, I've still got to pay the bills. So what I just started with a Wednesday, block of a
mm.
Wednesday as a low carb clinic day. And my website will book my low carb clinic with patients. And then a couple of days or one day beforehand, if there's no patients coming in, then I open up to coughs and colds or whatever comes in. So
Yep.
that's the arrangement. And from one day a week, it became 1.5 days a week. And now it's 2.5 days a week. And I've spread myself out to three separate locations. The main location is still in my clinic in Montana, which I've with the boss that I've worked for almost 20 years. So that's the main room. And if I don't have any bookings, they will book in the coughs and colds. And the other two location, sometimes I do have vacancies and I'm not fully booked and I just do some admin work. So
Mm,
one day a fortnight in the other two locations, which is the other side of the city. And I'm hoping to serve more widely in the Melbourne metropolitan area. And it does attract even country patients that come and travel to see me over an hour or two away. Unfortunately, with the Medicare restrictions, with the Medicare rebates, the patients have to see me within a year before they can get Medicare rebate. So we can't do telehealth with Medicare rebate. Some people do. I had patients from Perth or Tasmania, and they didn't worry about the rebates, and they were happy to book in for me for a telehealth. So there are patients like that, and yeah. So the receptionists do a little bit of help with the booking ins and the administrative work, but most of the work I do because I have my own website and I use a electronic booking system. Unfortunately, the receptionists who are used to booking in bulk billing 10-minute consultations isn't really equipped to book 30-minute, 45-minute consultations that I like them to. And I also have a system that patients can book in a free 50-minute discovery call with me as just an extra service that patients can have a chat and see what I'm like and decide if they like me and spend $330 before they spend the money. So every day around dinner time, I have 2 or 3 15-minute slots that patients can book in this free 15-minute discovery call. And those discovery calls, I don't make any money, but it's not about solving any medical conditions. I try to listen to them because patients like to be listened to.
Yes.
But so I listen to their medical problems a little bit, and then I advise them to come and see me to get their medical problems properly um, in a proper consultation.
Yeah. So yeah, I mean, obviously those initial calls would be a good kind of, lead generation as well, but then also kind of seeing if you're a good fit, right? I guess
Yeah,
to
that's
work
right.
together. Yeah.
Yeah, yeah.
Um, and um, there was something I was going to ask, which blanked. And what's the plan for the future? Like, is it kind of just to, oh, well, I think it was to kind of cut down more on the general practice stuff and do more of this. Like, is it eventually to,
Yes.
hire other GPs, or are you just planning on keeping it, lean and boutique, or have you thought about that? Or
I just have to play it by ear. I haven't really
yeah,
got very big plans, but that would be a really good idea if I can hire different GPs. I have incorporated nutritionists recently, just this year in the last few months, into the practice because I think it'll be a good fit to have a nutritionist, and she's also trained as a health coach. So Carla Viet Carter is a health coach slash nutritionist. She worked with Sydney Low Carb Specialist, so you can look up those people, and they have health coach as well. So Carla came and we became good friends, and we decided to do a package together called a Metabolic Makeover Program, and we decided to package it for a patient. That patient can pay upfront $999. With that package, they get 2 consultations with me, one 45-minute, one 30 minutes, and 4 consultations with Carla, the nutritionist slash health coach. And the patient can spread it out however they like. And with that program, I also throw in a bit of online course, a complete low carb guide course, as well as a low carb pro membership program where I Zoom my members every 2 weeks. So we're hoping this metabolic makeover can really help this whoever signs up to be establishing a solid habit of making them stick to a consolidated metabolic health program.
yeah. And
So yeah,
And how does it work? Like, is it a set, they have to do the sessions within a set time frame? And, is there some software that tracks, who's done the initial core or the second core? And, um, is it like a very rigid set program? Or as you said, is it
no,
like the patients
yeah.
can choose when they want to do it? But then is there like a expiry, or like how do you keep track of
Yeah.
all that?
We thought, no, we're not having an expiry. The patient can choose however long they like to do. And I just track it myself with
Yeah,
a little bit of a spreadsheet.
yeah.
We share the same medical note system using Galaxy. So Carla can see what I wrote. I can see what Carla wrote and blood tests uploaded into that system, just like a usual medical practice software.
Okay, Helixy, interesting. Yeah.
Yeah, yeah,
And general practice, some GPs find it very challenging, right? Obviously, yes, you do get the simple cough, cold, UTI, that sort of thing.
yeah.
But from the forums and talking to some colleagues, the breadth of general practice, anything could walk in through the door, autoimmune disease, musculoskeletal, always keeping the back of the head. Could this be something serious like cancer or something else like that?
Yes.
Addressing the patient's views, and then your agenda, preventative health.
Mm, yeah.
I guess some GPs might say, actually, I don't find traditional general practice a very mundane or boring. I find it too overwhelming or too stressful. Like, I don't know how have you found it? Is it just over the decades of experience with GP, kind of, becomes second nature or easier to you? Or like any comments on that?
Yeah, yeah. Some days I do find it really interesting, and I must admit I'm still enjoying seeing the patients because I've worked in the same clinic for 20 years. I do enjoy it, and I don't find it mundane every day. And I come home and I'm rewarded because the patients have grown with me, the children have grown, and I've seen that the 6 week baby become teenagers.
Hmm.
It is terribly rewarding, and elderly patients that come in and they have your all the usual complaints, and then we catch up. So no, I don't find it mundane every day, and it is still challenging, but I think it's over the decades, 2 decades of doing the same work over and over again. Some days it is more mundane than others, and this is certainly much more challenging with GP with special interest, and then trying to do social media marketing
Ah,
as well as branding myself, trying to spread my word. So it's just different kind of challenge, I think.
yeah, I think that's a good way of putting it. So I guess let's backtrack a bit. What made you, high school, want to do medicine? And then also how did you find medical school, and how did you end up choosing general practice?
Yeah, I actually did high school in Hong Kong. I'm Chinese. And I came to Australia, Melbourne, and did year 12. And I went to medical school straight away. Back then, um, it wasn't, what do you call it? We went straight from high school, year 12, to medical school. It's not, we didn't have to go into another bachelor degree. So, yeah, I thought I couldn't do doctoring, and it was a bit of a challenge. So that's how I got into medical school, and I had the points.
Yeah.
So, yeah, and after 6 years medical school, 3 years hospital work, I thought I wanted to know a bit about everything. So general practice came into my radar, and I know I wanted to get married and have babies, and general practice is very flexible, and it suited my lifestyle. And I had children. I had two kids. They are now 13 and 16. When the kids were little, I worked 1 half day a fortnight from when the baby was 6 weeks. So I returned to work quite quickly after having a baby, but I can only do 1 half day a fortnight, so it was terribly flexible.
Yes.
And I just gradually build up from 1 half day a fortnight to 2 half days a week and that sort of thing, and eventually build up back to full time because they're teenagers now.
Yeah. I
So
just wonder, what was general practice training like back in the day?
back 20 years ago, back, yeah, uh, we had 1 year of hospital program, and I did a diploma of obstetrics. So I delivered babies, and I did a general surgical ward and medical ward as part of the general practice training. Then we had GP work. We had to go to the metropolitan area and then the rural area. So just sitting in with other GPs and seeing my own patients, and had a supervisor to touch base next door. Um, it was not too hard, and it was just getting into GP land, and it was great. I thought
Yeah.
it was
Was
really
it
flexible.
was it the training delivered by RACGP back then, or was it delivered differently, or?
We had some training providers that are provider companies that are delivering our training.
Oh,
And
okay,
then
like
they,
GP Synergy or something like that, maybe. Yeah,
yeah,
yeah.
yeah.
Okay, no, that's okay.
Going
I
back
was just
20 years ago.
curious. And the general practice training, was that 1 year or 2 years or?
We had 3 years.
Yep,
1 year was hospital, and
yeah,
then 2 years was in general practice.
rotations. Okay,
That's
and
right, yeah.
was it mandatory to do like half and half, like half metropolitan, half rural, or how did that work? Do you remember? Or?
6 months was rural. So we had
Okay,
two basic terms and two advanced terms.
yeah.
And one of those 6 months terms needed to be rural.
Yep. Okay. And a lot of, I think GP registrars and, younger GPs, and they might be listening, they might, want to know, like, how did you go about choosing which practice to kind of settle down and grow your practice? Like, was there anything that influenced your decision to choose, the current clinic you're working at?
Yeah, the clinic was quite close to where I live, so that was great. And eventually I moved a little bit further away so I used to work 10 minutes from home when I used to live with my parents. And now I live 20 minutes from home when I've got my own house with my husband and kids. So distance was really important. And I've been told it's better to not live in the same suburb as where you work, because when you go to supermarket and shopping center, it's a great idea to not see your patients all the time.
Yeah, that makes sense. All right. Touching more on Melbourne Low Carb Clinic, I think there's a lot of providers out there about, weight loss, and obviously weight loss is a
Mm,
huge industry.
yeah.
How did you go about kind of differentiating yourself from competitors?
Yeah, I really like to emphasize about lifestyle, about natural therapies, about prescribing lifestyle instead of prescribing medication. I still do prescribe medications, and I embrace these new weight loss drugs, and some people do need these
Mm,
GLP-1s, and they sometimes, in many cases, they are helpful. But I really like to tell my patients that if you embrace lifestyle and go with improving diet and other lifestyle pillars, including sleep, stress management, strength training, exercise. Quite often, you can improve your health and improve your metabolic health naturally and heal from chronic conditions rather than continue to be prescribing more and more medications. So it's terribly rewarding, especially the de-prescribing thing that I am doing. And if you talk to a few other metabolic health GPs, low carb GPs, they all say that if patients are ready to adopt a low carb lifestyle, we can actually halve the insulin
mm,
straight away if they're a diabetic, and we can get rid of the oral sulfonylurea hypoglycemics straight away. And eventually, a lot of these medications can come off. It's great rewarding for the patient. It's great rewarding for the GP. And some GPs in UK, like you can look up Dr. David Unwin, he was going to retire. And since he's adopted prescribing low carb lifestyle, he's done lots of studies on how these patients can reverse diabetes, improve the HbA1c naturally with eating low carb nutrition. And it sparked his interest, and he doesn't want to retire anymore, which is great.
yeah. And is this coming, often is it the patient coming and requesting to come off these medications, or is it kind of more coming from you as a doctor, or?
A bit of both, because sometimes some medications can be quite dangerous if you combine low carb and if you still prescribe, say, the oral sulfonylureas can be quite dangerous. So you really have to get off those medications if you go low carb, and insulin as well. And sometimes some uh, hypertensive medications, especially the diuretics, will be quite dangerous if we go low carb and if we keep those medications. So I would encourage them to be getting off them. And sometimes some patients do want to get off them too. In some instances, like mental health, some patients can get off their antidepressants or even antipsychotics or even ADHD medications with doing the low carb lifestyle. We call it therapeutic carbohydrate reduction. So it's actually a therapy that we prescribe to patients as a therapeutic carbohydrate reduction. And patients actually treat it as prescription, and some of them actually monitor their ketone levels and aim to do good ketone levels. And that's how we can monitor how their progress is like and even get them off medications.
Yeah. Um, can you explain a bit more? How does the monitoring the ketones work? Like, is there like a target range aiming for, or like how often are they meant to be checking it? And,
Yeah, if if the patient depends on what the patient wants to do. So depending if you want to lose weight, get off diet, improve diabetes, quite often you don't have to monitor ketones. But some patients like to monitor because just like they count calories, they want to count something. So those patients can get a ketone meter. There are ketone meters that is just like the finger prick
Hmm.
glucose meter. There's glucose ketone meters that you can use different strips. The strips is some strips for glucose, some strips for ketones. So you can prick your fingers and insert the ketone strip. And if we want to aim for ketosis, then we would want to have the ketones higher than 0.5. And with the same drop of blood, they can monitor the blood glucose as well. So this is a finger prick ketone meter. There's also a continuous ketone meter that they can click onto their arm, just like the continuous
Hmm.
glucose meter that the diabetics do. So it costs around $100 for 2 weeks, and people can wear a continuous ketone meter. And I've played around with it, and there's an app you can see how your ketones go. And that might be a good way to monitor ketones. There's also, you can monitor ketones with urine dipstick strips and or breath ketone meter. So there's all sorts of way of monitoring ketones. And I don't suggest monitoring for all patients, and some patients like to do it. Some patients will stress themselves out. So different patients
Yeah.
suit different things.
Yeah. And also, yeah, look, it's a good point. A lot, me myself thinking back to medical school, not really taught that much that I can recall about, diet and the different types of diet. Can you give audience just a general overview about, low carb diet, low calorie diet, keto diet? Sometimes these terms are used kind of interchangeably, but yeah, can you shed some light on, what these are?
Yeah. Before I learned about low carb, I would be just like most doctors would say, if you want to lose weight, you need to eat less, move more. So that's a calorie in, calorie out model. What happens is this calorie in, calorie out really doesn't work because there's good calories and there's not so good calories. You can't compare a bit of salmon with a can of Coke
Right.
because the Coke will really spike your insulin. The more you work your insulin, the more you become insulin resistant. So what happens is your bloodstream can only hold 4 grams of glucose at a time, which is 1 teaspoon. So if you drink a can of Coke, that's like 10 teaspoons, and you will overflow with too much sugar. All this sugar, the body has to make insulin to ship this glucose away, and that insulin will make the glucose to store it as fat. So that is what insulin does. And we all know that from medical school. What happens is every time you eat, and if you eat 3 meals a day and snack 2 or 3 times on top of your meals, your insulin has to work 6 or 7 times or even more.
Mm.
And the carbohydrates will spike your insulin the most. The protein will also spike your insulin. The fat will spike, but not as much. So if you spike your insulin so often, so many times, and which is the high carbohydrate frequent eating that the usual modern lifestyle does, especially with the glucose and the processed foods, then most people will become insulin resistant. And the statistics tells us that 80% of the population is insulin resistant
Wow.
with metabolic syndrome. That is in USA 2016 data. So most of us cannot digest all the glucose and carbohydrates that we eat. Most of us will be producing heaps more insulin, and most doctors don't know how to test insulin. And if you do fasting insulin as well as fasting glucose, fasting cholesterol, you can actually tell much more by telling that if these patients have insulin resistant. So those people with high insulin more than 5, and if they have other signs of insulin resistance like building up belly fat, hypertension, high fasting glucose, high triglyceride, and low HDL, all those are signs of insulin resistant metabolic syndrome. And if you look up RACGP, there's a very good article on metabolic syndrome. You only need 3 out of the 5 criteria of metabolic syndrome to diagnose this metabolic syndrome. And if there's a patient coming in with high belly fat, even though the HbA1c is normal, you can actually tell, I can actually guess that they have high insulin and
Mm.
making too much insulin. So to reduce insulin, there's 4 ways to reduce insulin. One is eat less carbohydrates, so we're not spiking insulin as much. Number 2 is to eat less frequent. So eating 3 meals a day is much better than eating 5 or 6 meals. So the snacks in between the meals is what I'm trying to talk about. And the third way is strength training, building muscles can reduce insulin resistance. The fourth way to reduce insulin resistance is metformin. So most people don't like to go medication, which leaves you low carb, intermittent fasting, and strength training.
Mm.
So if you tell your patients these are the 3 ways to lower your insulin resistance, then gives them some framework that eat less carbs, and they can work on 3 meals a day and eventually maybe 2 meals. And maybe some days they can do a 1 meal a day as they gradually build up their fasting muscle. Those are really powerful ways to help patient improve insulin resistance. So this is really in getting the patients to reduce insulin way before they become a diabetic. Much more powerful than waiting the HbA1c to creep up above 6.5.
Mm.
And so low carb is different to low GI because you have to understand the GI is just the slower carbs. So when you say low GI bread, like wholemeal bread,
Yeah.
grain bread, sweet potatoes, they are still carbohydrates. They are
Right.
still glucose molecules linked together. They just slowly give it to your system rather than quickly give it to your system like the white bread, white rice. So I give an analogy like if you smoke a cigarette quickly or you smoke a cigar slowly, it's still very damaging to your lungs. So low GI diet, it doesn't work because you're still getting a lot of glucose into your system, but slowly. So that's why low carb will work much better than a low GI. And low carb diet, we prioritize healthy protein in terms of meat, eggs, chicken, fish, and tofu and legumes. Legumes and lentils are a little bit more carbs for vegetarians. And then we talk about healthy fat because in the usual diet, we worry about fat, and we've been talking about low fat diets since the 1970s.
Mm.
What happens is we really need the fat, and low fat diets doesn't work because if you do low carb, you really need some sort of an energy, and we need to have fat as an energy. Our body needs the fat for brain health, and our body needs fat for hormones and immune system. Also, the fat-soluble vitamins like A, D, E, and K needs a healthy fat to transport it into your system. And doing low-fat diets really has other problems, like it can increase your risk of um, gallstones is a secondary effect to low fat, and it affects your hormones because again, hormones is made out of fat, and if you don't have enough vitamin D, E, A, then it has other side effects like reduced immune system because we need vitamin D for immune system. So I talk about prioritizing protein, eating healthy fat, and eat what your carbohydrate tolerance is. So as I discussed before, with the statistics, 80% of the population is insulin resistant. So these insulin resistant people really shouldn't eat so much carbs. Whereas if your carb tolerance is okay and you're not insulin resistant, maybe you got tested for your insulin and you're not insulin resistant, maybe my 16-year-old who's active and who has muscles, he's not insulin resistant. They can do more carbs, so they might be able to eat more bread and sweet potatoes, and so eat according to your eat carbohydrate, include according to your insulin and carbohydrate tolerance. And that's the basic of nutrition. So those are the macronutrients is good protein is what we need, healthy fat, and eat according to your carb tolerance.
Mm. What are some examples of healthy fats then compared to not healthy?
Yeah. Healthy fat is things like avocado, nuts and seeds. Dairy is actually healthy fat, like cheese and yogurt, they're great. Even the fat around the meat are actually healthy fat.
Mm.
Eggs are great, healthy fat. Eggs has got protein and fat, and it's got everything in it. Olive oil is also great. As opposed to the trans fat, the polyunsaturated fat
Mm.
is not healthy fat. So the margarine is not healthy. Butter is good. Butter is healthy. And then we call it seed oil, which are vegetable oil, canola oil, sunflower oil. They're highly processed oil.
Mm.
They are actually quite inflammatory. They may have increased risk of heart attacks
Mm.
and even cancers. So there are studies showing these trans fat or polyunsaturated fat can really increase our risk of chronic conditions, which are cheap oil, that if you go to the deep fried takeaway shop, most
Mm.
of the chips and the KFC will be cooked in those oils, which is why we all know that the takeaway is no good for you. But then if you look at the food label, these trans fat are in everything,
Mm.
like margarine and even the packaged chips, snacks, the processed foods, even the packaged margarine, mayonnaise, and salad dressings, they are all in those,
Mm.
yeah,
Yeah.
processed foods.
It is interesting. I remember growing up, and yeah, I think the teaching or my parents would say, "Oh, butter's really bad for you, but margarine's like a healthier alternative." So, it is interesting.
Yeah, I think that's in the 1970s. That's when the propaganda started because they manufactured. the margarine as because they're worried about the heart health.
Mm.
And there's big propaganda saying margarine is much better for you. Now we've come to learn that margarine is processed, it's bleached, and it's mostly vegetable oil, seed oil in it.
Mm.
And if you look at the ingredient list, it's probably got 10, 20 ingredients in it.
Yeah, wow.
Whereas butter is natural and it's healthy, and butter's made a comeback.
Yeah. Interesting. Yeah, okay, that's a good point, because often, fat is just put into one category, fat is bad, but that's a good point. And how does low carb diet differ, or does it differ from ketogenic diet, keto diet?
Yeah. Ketogenic is really, really low carb. So we usually say it's less than 20 gram a day. Low carb is around less than 50 gram a day.
Mm.
So keto diet is actually the metabolic state your body is in. So if you're in ketosis, we call it keto. It's a metabolic state rather than a diet. So we have to differentiate ketosis as opposed to ketoacidosis. Ketoacidosis is in diabetics, their sugars are really high and they're actually acidotic.
Mm.
So that's a different acid alkaline balance. Whereas if you're in ketosis, your pH is neutral, you're not acidotic, and you're burning ketones, which is burning your fat or burning dietary fat. So, as discussed before, we can measure our body ketones and we aim to be more than 0.5. And your body is burning your own fat. So, we can actually access to burn our body fat as opposed to burning the glucose that comes in from food. And these ketones actually have special powers that it helps you to not feel hungry. It helps you to be satiated. It's anti-inflammatory. And the more you have, the more it helps with brain health. So some doctors have been taught that our brain needs glucose, but in fact, our brain actually works much better on ketones. And
Mm.
when you're in a ketosis, some patients actually describe they've got much clearer brain and their brain can work much, much better with clearer mind and
Mm.
they have much more energy. And if you can experiment. And if you want to fast a bit longer than 12 hours, or even get into a 16 or even 24-hour, in the end of the fasting, the last few hours of fasting, you probably will be in ketosis. And you might actually feel not as hungry and better brain power. So keto diet is in ketosis. Your body is burning fat. Whereas the low carb diet is like less than 50 gram, or some people say less than 100 gram.
Mm.
You still get the benefit of reducing carbohydrates, where because as opposed to the standard Australian or standard American diet, we're actually eating 200 to 300 gram of carbs or
Wow.
glucose a day. So it's actually a lot of carbs. And because we're eating nonstop, we're snacking, we have accessibility to so much processed foods. And every meal we have carbs, we have chips and rice and sandwiches, cereal, biscuits, muesli bars, which is actually more glucose than protein, even though it's called protein bars. So, yeah, so the standard diet, it's very high in
Wow.
carbohydrates.
200 to 300 grams a day. And as you said, kind of low carb diets less than, I think you said usually 50 grams.
Yeah.
So how do patients like measure this? Is there like a cheat sheet or like an app? Like how do they keep track of?
Yeah. Again, I don't, so different people like to measure, and I don't tell everyone to measure. If they like to measure, and some people do, because some people are engineers, they like spreadsheets or they like to count things. They can get some apps that they can put in all the meals, like Chronometer or Carb Manager. So they can actually put in all the meals and count the carbs. Those people who don't like to count, and I think majority of people don't like to count carbs, I just give them a sheet with traffic light system. The green foods is mainly the meat, eggs, chicken, fish, above ground veggies, and so there's the green list.
Mm,
Then there's the orange list, which is the in-between foods. They're like root vegetables, potatoes, sweet potatoes, corn, peas, and that sort of food. And then there's the red list, which is higher carbs. And if the patient's wanting to do low carb or keto diet, they really want to stay away from the red foods. The red foods will be bread, potato, pasta, biscuits, cakes, crumpets, cereal, oats, rice, that sort of carby food. So, yeah, usually the traffic light system will be sufficient. They just look at the list and then they know what food's good, what's not so good, and they buy according to the green list. But yeah, again, different people want to do different things. And if they want to count carbs, I think counting carbs is much better than counting calories
mm,
because counting calories, again, it doesn't take into what food is nutritious and what food isn't nutritious. So you
right.
can't compare a 100 calories of biscuits with 100 calories of steak because the steak will be having so much protein, healthy fat, and micronutrients. It got zinc and vitamin D. Whereas the biscuit's just empty calories and it will spike your insulin and cause gut dysbiosis, affect your gut microbiome.
Mm.
So yeah, that's we haven't talked about the gut microbiome, but that's another big um topic that
Yeah,
yeah.
yeah. And I've had a guest on the show, Dr. Suresh, who I think is up in Brisbane.
Yeah. Yeah, I know
You know,
him.
and yeah, he's got his own social media podcasts. You know, so for listeners, you can check out that episode as well. He talks about you know, carnivore diet, and I think I've watched some of his videos, YouTube videos as well. Like,
Yeah.
what's your thoughts on carnivore diet? And you know, some people say it was very good. Some people said it was good for a while, but then had some side effects. Like, what are your general thoughts on carnivore diet?
Yeah, surprisingly, I actually really like the carnivore diet. That's going against a lot of doctors' intuition because we've all been taught to eat the rainbow and eat so much vegetables and fruit.
Yeah. And
But
also, I remember, I think, yeah, like red meat, you know, increased risk of bowel cancer and I think other cancers and that sort of thing. But
yeah,
yeah,
yeah.
yeah,
So there's a lot of things that we need to unlearn and relearn. There's a lot of propagandas that has been promoted, and some of these propagandas have been promoted by the big food industry
right.
and even the veganism, vegetarianism, plant-based idealization, ideologies. Um, so there's not much evidence actually to show we need to eat so much vegetables and so much
Mm.
fruit. And the agricultural business have actually put in that we should eat five serves of veggies and
Ah, right.
so much serves of fruit today. And what so we actually don't need so much fruit and veggies. But what why are we demonizing red meat is there's another propaganda by the veganism people has been telling people that veganism and as well as the big food industry have been telling people that red meat is no good. So in the dietary guidelines back in the 1970s, there's big food industries funded by the cereal companies, Kellogg's, and even the Seventh-day Adventists who had religious ideations were about red meat and meat in general can increase um, different religious ideations, like they increase masturbation, and that's why um, the religious ideations don't want us to eat so much meat.
Mm.
So there's lots of influences on how the dietary guidelines have come about. And the studies that show red meat can increase your risk of cancer, there's a whole lot more studies that show red meat doesn't cause cancer, whereas this cherry picking and big food propaganda has confounded these studies. So there's a lot of darkness that I've learned, and if you look up, Belinda Fettke is a lady who's done lots of research, and if you look up her YouTube channel or her website, you might be able to find out how we come about on why we're eating this way.
Mm. The surname sounds familiar. F is Fettke.
Yes, that's right.
Yeah.
Fettke.
Okay.
Belinda Fettke's husband is Gary Fettke,
Ah, okay. Yep.
and you might have heard of Gary Fettke, who is an orthopedic surgeon in Tasmania, and he's been in trouble with APRA because he's an orthopedic surgeon seeing lots of legs being chopped off. And he started to tell patients, don't eat sugar, don't eat carbs. And in that way, you can improve your diabetes. And he's been in trouble because the dietitians have complained about him that he's not a dietitian and telling patients to eat healthy.
Mm.
So yeah, people can go to YouTube and there's lots of videos from Belinda Fettke and Gary Fettke, and yeah, your listeners
Yeah.
can learn.
Interesting. Yeah. All right. So we've talked about low carb diet, keto diet, carnivore diet. Um, was there any other diets that you wanted to discuss or that, people
Yeah, just
often
to
like to do or
just to add, a lot of carnivores actually come in to see me because they have changed their lifestyle and they have become carnivore themselves. And because the doctor isn't supportive and they haven't learned how to look at the blood test cholesterol, again, your doctor audience might have to learn and relearn, unlearn about the cholesterol. And there's lots of YouTube videos about cholesterol. But a lot of these carnivores coming to see me that they've improved their health so much that they've lost so much weight. And carnivore diet can actually improve their autoimmune conditions, improve their gut health. They feel so much better. And their doctors aren't supportive. So I see them at the other end after they've become the carnivore, eating only meat only. And I see that they have amazing health. So I would encourage doctors to look into it and be open-minded and do the research themselves rather than just blanket rule, not willing to learn.
Mm. I think that's good tips. Always, yeah, try to um, yeah, have a look at the evidence and research yourself.
Mm.
All right, and so let's see, we'll talk about those. So, well, I guess this ties on to yeah, for GPs that are interested in the weight management space. There's so many courses and things and etc. that you could do. Any kind of tips for them?
Yeah. Again, I would encourage them to be open-minded and start learning. And I think some doctors aren't willing to learn because they're not happy to give up their own carbohydrates. They want to hang on to their bread, potato, pasta, rice. So, but they can start learning about how to prescribe low carb lifestyle by looking into the YouTube channel Low Carb Down Under. There's so many YouTube videos in there that are from previous conferences. There's 10 years of Low Carb Down Under
Oh, wow.
conference, and Dr. Rod Taylor, who's the founder, just put them out there into the YouTube channel. And I've also done lots of learning through Nutrition Network, which does cost money, but they're amazing recordings. Nutrition Network is from South Africa. There's Low Carb USA, who hold conferences a couple of times a year, and they are affiliated with the Society of Metabolic Health. And I have made myself a metabolic health practitioner through the Society of Metabolic Health, connecting with the metabolic health practitioners in USA. And that's another whole lot of different practitioners.
Mm.
So there's a new society called the Australasian Metabolic Health Society, AMHS, which is set up by the Sydney low carb doctors, Dr. Deepa and Dr. Alex Petrovsky. So there's actually quite a few of us in the low carb space who are low carb lifestyle GPs who are prescribing low carb and actually feeling so much more rewarded in prescribing healthy nutrition. And I actually tag on to healthy nutrition to just about every single normal GP consults as well. If they're coming for a cough and cold, I actually tell the patient to don't eat sugar because it's inflammatory. And I tell the children to lay off the sugar, lay off the lollies. And if they have gout or some other metabolic
Mm.
conditions, I also tag on to avoid so much carbohydrates or soft drinks or even
Mm.
alcohol. So it comes into a lot of usual general practice consultations, not just about weight loss or diabetes. And diet is so asking patients what they eat is actually really rewarding. And even mental health conditions, if you do a mental health plan, if you incorporate diet and nutrition into their mental health plan, your patients will be rewarded by eating whole foods. And even if you just tell them get rid of the sugar and processed foods,
Mm.
they will improve their mental health that way. Even if you don't tell them low carb, just getting rid of sugar, processed foods, you know those are not good for you. And telling them to reduce inflammatory foods that can help lots with mental health.
Mm. Yeah. And now moving on to paid speaking and breathwork. How did that come about? Was it mainly kind of like, I don't know, some people might say, one-on-one consultation, but then paid speaking, you can, help or talk to a wider audience. How did you get into speaking?
Yeah. Was invited by Low Carb Down Under to do a little bit of speaking. So I did a couple of talks through Low Carb Down Under, mainly sharing about my low carb journey and how I become a low carb GP. But I decided that this is very rewarding, and my message can spread to many, many audiences. And I thought if I get into speaking, I can spread the word further. I started my own podcast called Prescribing Lifestyle, and your audience can check out my podcast, which is free. Just like doing podcasts, it doesn't get you any money, but it's very rewarding and connected with lots of speakers and a podcast guest. And so I started to do some paid speaking gigs. I was invited to host breathwork and a nutrition talk a couple of weeks ago, and I signed up to Speakers Institute, learning to
Mm.
how to speak better, getting more confidence, and how to reframe my messages. And I'm hoping to get myself out into different speaking gigs, like talking to corporate, talking to different audiences, and yeah. So and breathwork is another way that I've learned that we can help patients with their mental health with teaching them how to breathe better. So with breathing better, it's another whole new world that we've never been taught how to breathe better. Like we've never been taught that we have to breathe through our nose rather than breathe through our mouth. And I've incorporated this into the usual general practice. And with patients incorporating breathwork, we can help them relax and help them increase their parasympathetic nervous system drive. And with such a busy lifestyle that we all have nowadays, with rushing around, going everywhere and driving around, drop off pickups, lots of children and work, everyone can have some sort of a downtime incorporating breathwork, mindfulness into their life. And I started hosting my own breathwork workshops that that I can teach them how to breathe better, breathe slower, breathe deeper into the diaphragm, and even lighter. That can help to improve their breathing, incorporate breathing into their lifestyle as part of their routine. Then we don't spike our cortisols as much. We can have a way to slow down our nervous system. Let's say we have a panic attack, we can slow down our breathing to breathe slower, breathing in for 5, breathing out for 5. And patients can actually control the nervous system, regulate their heightened state. And that's another tool to help patients with improving stress and improve their lifestyle. Naturally, we all have our breath to harness, and that's another natural way, not needing to prescribe medications. And there's lots of things you can reverse, like even improving asthma, improving hay fever, improving snoring, reducing stress and anxiety, all through breath work. And I've coached patients this way with incorporating breath work into their life.
Yeah. So in breathwork, this is interesting. I haven't really heard about it until recently. And is there any, like, it sounds like pretty much any patient, is there any kind of patient group that you wouldn't suggest breathwork to, or any particular group that, can't
Yeah,
do the breathwork, or?
depends on what type of breath work you do. You really should have training to host breath work. There's different types of breath work. There's slow breath work and there's fast breath work. There's fast Wim Hof style. Your listeners can look up Wim Hof, which is a breathwork facilitator. So fast breathwork style breathwork might not be suitable for those with severe anxiety,
Mm,
uncontrolled hypertension, epileptics that's not controlled, and even pregnant women, they not
mm,
be suitable. But everyone can slow down on their breathing, so slow breathworks can be suitable for most people. But then again, some people who have lots of anxiety and stress, they find it very triggering just to slow down the breath work. And they might need to go slowly on
mm.
slowing down, because if I teach them to breathe in for 5, out for 5, it might be too slow for them and they might feel very triggered and they have their mind all over the place.
Yep.
So maybe slowing down to in for 3, out for 3, that might be slow enough for them. So again, it's tailoring to their type of nervous system and their different type of anxiety, stress that can help to teach them to regulate their nervous system.
Yeah.
There's a heaps of health coach and naturopath that gets into breath work or breath work facilitators. And again, us as doctors have to be open-minded. That's another way that we can get our patients to help with healing.
Mm,
They can even improve their ADHD, improve their stress, anxiety, panic attacks. It might not be for everybody. Some people might still need their antidepressants or antipsychotic, but it's more therapies, different type of therapies.
yeah. And then what about low carb? I think you touched on, is there any kind of patient group that it's kind of not for?
Yeah, yeah. Some people have eating disorders, and if you tell them to go on a low carb diet, that might trigger
Mm,
their eating disorder. So they might go uncontrolled, intermittent, too much fasting, too much cutting calories, or they get obsessed about really stay away from carbohydrates, that they get into a mental disorder themselves. But then again, there's some evidence with well supervised ketogenic diet that can help with anorexia. So very interesting.
mm. And some of the side effects, low carb diet, I think just a brief reading, headaches, muscle cramps. Is there kind of, are these more short term? Is there any long term side effects of a low carb diet?
Yeah, usually those are short term in the first 2 weeks. We also call it keto flu. These people get aches and pains, headache,
Mm,
withdrawal symptoms, muscle cramps, tightness, fatigue. These usually helps with taking more salt. So again, our doctor audience have been told not to have too much salt. Again, that's been wrongly demonized. Our body needs salt, and those with good kidney function can really do with more salt. And especially in the first 2 weeks of a ketogenic diet, having extra salt will help with reducing the keto flu symptoms. Because if we reduce our insulin, our body actually urinates out a lot more salt, and having extra electrolytes will help with balancing out the
Right.
keto symptoms.
Okay. Perfect. Um, so finishing up, I guess social media, and kind of promoting yourself for the speaking and through the low carb clinic business as well. Any kind of tips for doctors, putting themselves out on social media? Some might be too worried to do it, but other people also might be worried. Obviously there's regulatory body guidelines as well. But yeah, any tips for doctors kind of considering social media?
Yeah, yeah. It's tricky. It does take a bit of confidence to put myself out into social media. I put myself out on Instagram and Facebook as Dr. Charlton Lifestyle GP. And LinkedIn, I like to put it more for the um, professional contacts to get more speaking gigs and connect with other doctors.
Yep.
I think it is necessary because patients are looking for information and patients like to see your face out there. And if you've got a brand you want to promote, then social media is the place to promote yourself. And you certainly have to stay within your regulatory board, like APRA. Like I wouldn't put testimonials on patients before and after photos. And I'm very careful with putting um, patient stories on how they've improved their health because APRA will be coming back at me. So I think as long as you stay according to the APRA rules, then sharing information, and I wouldn't be giving out medical advice over
Mm.
social media. So again, if the patients would private message me, I would just tell them that you've got to be my patient before I can give you medical advice. But I haven't actually gone into a lot of trouble through social media.
Yeah. Yeah. Perfect. And finally, how can people find out more about you, connect with you, follow you? We'll put it in the show links as well.
Yeah, again, through Facebook and Instagram, my handle is Dr. Charlton Lifestyle GP. And LinkedIn, I'm just Avi Charlton. I've got my YouTube channel, which is again Dr. Avi Charlton, and my podcast is Prescribing Lifestyle, and it's coming up to a 1 year
Oh, nice.
anniversary on 1st of May. I'm up to about 90 episodes.
Oh,
It's
wow.
terribly rewarding. I think you have more.
Oh, I think I've got 60 something. I currently do one a fortnight. So you must be doing a weekly one or tw two a week or
Some weeks it was two a week, and
wow.
some weeks it's one a week. I used to do two a week most weeks,
Yeah.
and then I've slowed down to one a week most
Yeah.
weeks.
Pacing yourself. That's right.
Yeah, yeah. But it's terribly rewarding and I love doing it.
Yeah. Well, thank you very much for coming onto the show. I think our listeners will have immense benefit, and yeah, lots of questions and homework and reading after this episode as well. Um, Thanks everyone for tuning in to another episode. Please share this if you found this useful. Share it with a colleague or a friend. Yeah, we'll be interviewing other doctors on as well. Until next time.